cases as of April 8th. African-American Mississippians accounted for more than half of all cases and 71% of the deaths. And now, Walt Gray, 71% of the deaths. On Mississippi Insight, Governor Tate Reeves answers your questions. The outbreak of COVID-19, the number of cases and deaths rising every day, the impact on daily life and the economy, the state hard hit by unemployment, what people need to know.
I believe that leaders step up in times of crisis, and thanks to the support and help of many, many thousands of Mississippians, and we are making a dent. We are slowing down the spread of this virus. We are actually flattening the curve as we anticipated.
Hello, and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. I'm coming to you from the set of our coronavirus town hall with Governor Tate Reeves held earlier this week. We were joined by the governor and two representatives from the state health department, Dr. Paul Byers and Jim Craig, also the director of Mississippi Emergency Management, Craig Michel. Tonight, we are going to bring some of the highlights from the town hall as we talk with the governor on a number of topics, starting with unemployment. Walk us through the process of filing for unemployment. Where do people need to go? How do they file? And who qualifies for unemployment?
Well, I just want to make sure everybody in Mississippi understands the severity of this economic crisis that we have. We all know that there's a public health crisis, and in the short run, we're making decisions to deal with that. But in the long run, we're going to deal with an economic crisis, the likes of which this country hasn't seen in a long, long time. Just for instance, in America, prior to last week, there were in the largest one-week increase in overall numbers of unemployment insurance claims was 700,000. Last week, we had 6.6 million unemployment insurance claims in America. And this week, which came out earlier today, we had an additional 6.6 million claims. That tells you that for 2 weeks in a row, we're 10 times greater than any 1 week period in the history of America. And so this is very, very challenging. To put it in terms of Mississippi, the week before this pandemic really took off, we had less than 1,000 new unemployment insurance claims. The week after that, we had 5,500. Last week, we had 32,000. And this week, it was reported this morning that we had 45,000 new claims. Again, almost between 85 and 90,000 new claims in Mississippi in the last 3 weeks. It is mind-boggling how many new claims. And many individuals that are trying to file haven't been able to get through. And I know it's been extremely frustrating for Mississippians. It's been frustrating for me. But I want you to know, the way I want you to think about this is if you were at work today and someone came in and asked you, hey, I need you to do 8,000% more work tomorrow than you did today, we would all understand how difficult and how challenging that would be. We've worked really hard to improve our systems. Mississippi has made tremendous progress as it relates to that. And I want everyone to fully appreciate and understand this. You are going to get the benefits that you are entitled to based upon when you lost your job, not based upon when someone answers the phone at the Mississippi Department of Employment Security. We've taken significant measures to improve the access. And through our call center, we've increased the number of employees from approximately 50 to approximately 150 over the last 10 days, and we're going to try to increase that by another 100. But the best thing that you can do if you want to walk through the process, the best way in which to do that is to go to our website, www.mdes.ms.gov. That's MDES as in Mississippi Employment Security Commission, MDES, Mississippi Department of Employment Security.ms.gov. That's the best way to do it. In terms of the people that are going to qualify that may not otherwise have qualified, there's a couple of different changes that we made. Very early on, I made the decision to waive state law, which requires a 1 week waiting period. So now you are no longer having to wait for a week. That's going to take the time that you actually get your first check down from approximately 14 days down to 5 to 10 days. In addition to that, I have waived the requirement in state statute which says you have to be actively looking for a job, because we understand that when 80-something thousand people lose their jobs that have just disappeared in a matter of days, that requirement is unnecessary. In addition to that, through the Federal CARES Act that President Trump signed, if you are a self-employed individual, you would not have been eligible prior to the CARES Act passing, but now you are eligible if you have lost your job. If you work for a religious entity, and there's a number of categories that historically you would not have been eligible for unemployment, but now you are. Mississippi, by the way, is going to be one of the first states in the nation that additional $600, which is under the pandemic unemployment insurance plan that passed in the CARES Act, those monies are going to be available for those who are entitled to it as soon as this weekend. And so Mississippi will be one of the first states in the nation to get that done. Now, everyone's not going to get it, but everyone that's entitled to it will ultimately be able to get it. The way in which we do this, because a lot of times people ask, when will I get my check? Nowadays, we no longer do it by check. We do it by debit cards. And so it takes you a few days to get your debit card in the mail. But those are coming if you have, if you are eligible, and if you are one of the 80+ thousand that has applied, that has been granted those unemployment benefits.
A lot of questions about unemployment. Lindsay Kellum is wondering about people who work a second part-time job on top of their primary job to make ends meet. Does Mississippi provide partial unemployment benefits, and is there any assistance for reduction of hours or loss of second job or retaining a primary job?
The simple answer is yes, yes, and yes. Unemployment benefits in Mississippi are based upon the amount of money that you earn in a particular week. And so if you are significantly reduce that amount of money that you're earning, or you significantly reduce the number of hours, which leads to significantly less revenue, significantly less income, you can maintain work and still be eligible for certain unemployment benefits.
All right, Jade Alexa, let's go to her. She's now monitoring some other questions from the newsroom. Jade?
Byron, we are getting tons of questions coming into our newsroom. This one is for the governor from Lisa Larry. She wants to know what regulations are in place to ensure that employers are protecting their employees in the event that one of them is tested for COVID-19. Governor?
Well, thank you, Jade. Appreciate that question. I think it's extremely important. Very early on in this process, we issued an executive order which allowed for and maintained what the essential businesses were in Mississippi. It was a comprehensive list. It was based largely on the list that was put out by the Department of Homeland Security of the United States government, and particularly their task force as it relates to essential infrastructure in this country. So we have a list of essential employers, and we maintain that those essential employers must remain open.
When we come back, the frightening demographics: nearly 3/4 of COVID-19 deaths in Mississippi are African Americans. We talk to the governor about that next. Welcome back. We're recapping the coronavirus town hall from earlier this week with Governor Tate Reeves. We talked with the governor and the state health officials about the new demographic numbers showing how the virus disproportionately impacts the African American population. Our next question. This week, the State Department of Health started adding demographics information for COVID-19 cases. As of April 8th, African American Mississippians accounted for more than half of all cases and 71% of the deaths. That's despite African Americans making up only about 38% of Mississippi's population, according to estimates from the U.S. Census Bureau last year. Dr. Byers, earlier this week, you said that many had underlying health problems. Do you know if many of them had or were lacking health insurance?
That's a great question. And, you know, there's still a lot of data that we're collecting, and that is a question that we need to look at. And that's data that we need to look at to determine access to care. We know that we've had for a long time chronic underlying medical problems at a higher rate in our African Americans in Mississippi. We know that for a number of reasons, this has been a problem that we've faced for many years, and that's multifactorial. We need to look at from our data now to determine, because we don't know a whole lot about this virus yet, we need to know why it's impacting African Americans more. We do know that African Americans have higher rates of chronic underlying medical problems, and if you look at the data that we do have published now, we know that there are, among the deaths, higher rates of hypertension among African American deaths, higher rates of cardiovascular disease among African American deaths, higher rates of diabetes among African American deaths than those in the white deaths. And so we do need to look at this data closely. I think that there's a whole lot of information that we need to continue to gather. And on the back end of this, we're going to be able to get a clearer picture of exactly what's going on.
Governor, given another question coming out is, given all this information, a viewer would like to know, during this emergency, have you changed your mind whether the state government should expand Medicaid?
Well, let me first say, Byron, I want to commend the Department of Health. We have worked with them very, very closely through the beginning of this, and they have been very diligent in being willing to release data. Mississippi was one of the first 10 states in the nation to release demographic data as it relates to this particular virus. And what we are finding is in Mississippi, just like in other states, that some of whom have expanded Medicaid, some of whom have not, all of this data looks very similar. And that it is attacking those with chronic underlying conditions. This particular virus has not changed my views on the expansion of Medicaid. The one thing that has been made clear to everyone by President Trump, by Vice President Pence, is that everyone is going to get treated for this virus regardless of their method of payment. The federal government is stepping up and providing $130 billion to hospitals around the state. When you talk about Medicaid expansion, what you're really talking about is an insurance program paid for by the taxpayers that is going to remove some individuals from private health insurance, and it's a method of payment. It is not a method to ensure either access to care or to ensure quality of care.
And so what needs to be done going forward once we get past this?
Well, I think we've got to continue to communicate, to talk with individuals, to make sure that every individual is making good decisions themselves, that they have access to quality foods, things such as that. Many of the underlying conditions that Dr. Byers spoke to, this is a multi-generational challenge. This is not something we're going to get fixed overnight, but we do need to continue to work to improve the quality of health amongst our African Americans in Mississippi. But quite frankly, we need to improve the quality of health amongst all Mississippians. As when you look at things like hypertension and diabetes, we're in the top 3 or 4 in both of those categories in our state. You look at the number of smokers in Mississippi, we're at number 6 in the nation in number of smokers per capita. All of those things have an effect on the underlying chronic conditions, and ultimately it appears, at least with the early data, and again, there's a lot of analysis yet to be done, but those all appear to be devastating factors with anyone who gets the coronavirus.
More with the governor when we come back. Welcome back as we bring you highlights from the past week's coronavirus town hall with Governor Tate Reeves. We looked at several issues, including the push for medical supplies, specifically personal protective equipment for frontline healthcare workers.
We have been getting supplies in every single day, and we've been trying to distribute them first to the Tier 1 hospitals, but also to our emergency management personnel in our various regions across the state. We want to make sure that we have adequate PPE in our hospitals, but also adequate PPE for our first responders, et cetera. And to that individual that is working on the front lines, I just want to say thank you. I'm praying for you. I appreciate what you're doing. You are doing the Lord's work. Every single one of you, the doctors, the nurses, the nurse practitioners, every single healthcare worker that is working to fight this virus and fight this disease, I want to thank you for what you're doing. Greg, you want to talk a little bit about the PPE?
Sure, Governor. Great question, and we get that question a lot, particularly with our healthcare workers that are working on the front lines with COVID cases. As the governor has stated, we did get one of 2 shipments that we were expecting. That one, as we were coming in here today, we were unloading. We got another one coming in later tonight, and then we've got another load that's coming in tomorrow, a fairly large shipment of PPE. PPE has been problematic. It's been problematic worldwide to get it in, but we were one of the first states to get out and establish kind of our own supply line with state resources, and it is coming in, not as large as we'd like it to, but it is coming in, and we're pushing it out just as quickly as we get it.
How are you determining where those PPEs are going?
So the Mississippi Department of Health very early on had already established your priorities by tier. And of course, those healthcare facilities, long-term care facilities that are treating COVID patients are getting the first priority efforts of those. Those shipments are actually going straight to those facilities. And then as well, our lower tiered shipments are going out to the county emergency management agencies, and so we push it out accordingly. But those healthcare workers that are working with COVID patients get priority on that fill.
And Byron, let me also just point this out because I think it's important. You know, we have activated over 250 National Guardsmen that are helping on the logistics. They're working in a humanitarian way on this particular crisis, and they're supporting our teams. And I just want to personally thank the men and women in uniform who are working hard every day to distribute that.
Another question, Governor. A 12 News viewer asked whether there should be hazard pay for nurses that risk exposure to COVID-19 on their shifts. The city of Jackson just instituted that policy for first responders Tuesday. Is that something you would institute statewide for healthcare workers?
Well, what I would tell you is I can't thank the healthcare workers enough. You know, the reality is that they get up every single day and put themselves at risk of catching this virus, but they get up and put themselves at risk every day as they treat patients, and I'm exceptionally proud of them and proud of what they're doing. We hadn't had any conversation about hazard pay statewide. Many of these individuals work for non-governmental entities and things such as that, and so we'll certainly have that conversation, but that's not one that we've had at this point.
Sure. Our next question is coming from Tanitra Evans, who is curious about religious exemptions to the social distancing policy. Let's hear what you have to say.
Hello, Governor Reeves. My question is, does the social gathering limit of 10 people or less include churches?
Well, thank you for that question, and obviously that's been a point of contention and a point of debate over the last couple of days. And let me tell you what I believe. I believe that government cannot shut down churches. I believe that there's a constitutional right for our churches to be able to meet. But I also believe that all of us in the state have to chip in together. And I have strongly encouraged pastors across Mississippi to not have church services with more than 10 people there. I think that given where we are in the cycle, if we'll all do that for a couple of weeks, and look, it pains me to say that with tomorrow being Good Friday and Sunday being Easter, it absolutely pains me to say that. But we need everyone to chip in. You know, and we had a pastor from down in Adams County yesterday that came to our press conference, and he was being threatened by local government, and he wasn't going to back down. Well, my team and I called him and said, look, we understand that you don't want to be shut down by government, and we don't think you can be, but we do think you can make good decisions. He made the decision that he's not going to have, he shut down Bible study on Tuesday night. He's not going to have services with so many people there today, and that's what we're asking our pastors across the state to do. Now, I will also tell you that I have heard reports of local jurisdictions shutting down services for those individuals who actually are in their own vehicles, and they have a radio application where the preacher is preaching to them. No one has gotten out of their vehicle, and I just don't think that's right for the local governments to be doing that either. Our pastors, I beg you, I plead with you to make the right decision. Don't have in-person church services, but I think the local government's trying to take away their constitutional rights is the wrong approach.
So the advice then is to do what? They can do
my advice is to not do church services with more than 10 people. Figure out a way to do it online. We can worship online. We can worship by Facebook Live. We can worship by all of the different apps, Zoom, etc. We as Christians in Mississippi know that Easter is not about a building. Easter is about Jesus Christ being risen, and we need to understand that. We need to celebrate it. We're going to do that in Mississippi. We're going to do it in special ways. We're going to do it in different ways than we do most Sundays, but we can do that. We can protect ourselves and still worship on Easter Sunday.
We'll be right back. Right back. And now, Walt Grayson.
Well, you may have noticed that we at 12 News are trying to do what we can to work remotely right now, do what we can from the house. That's kind of limiting our exposure to one another and from one another. Now, our weather team seems to have this down pat. Matter of fact, I was beginning to wonder if they were ever coming back to work. Being around the house is kind of interesting, though. I find I have time for hobbies that I set aside years ago, thinking I didn't have time for them anymore. But since I can't go do stories right now because of social distancing, I have all kind of time. Don't tell Miss Jo that, or she'll find something for me to do. And checking Facebook, I see that a lot of my friends have discovered the same thing. For instance, my old buddy Judy Moon Denson, she's been for a long, long time now. You might remember her as longtime favorite weather girl here in Jackson a few years back. Anyway, Judy posted this picture on Facebook that she had painted years ago, and it now belongs to someone else. But Judy says seeing it again has inspired her to perhaps take up painting again. Then an old high school friend from Greenville, Charlie Lum, who is a professional photographer, posted these shots of flowers. Now, Charlie is more into portraits professionally, but he said he was inspired to shoot these flowers when he saw some flowers that a friend of his had posted. And can you guess who sketched these? You've seen his work, Marshall Ramsey. Of course, usually we see his editorial cartoons, but this is a side of Marshall we don't get to see all the time. He said after he posted these to Facebook that a friend of his commented, "I didn't know you could draw." You know, we have the time right now, and we can spend that time surfing television or petrifying ourselves with the latest COVID news, or we can discover living again and discover ourselves and amaze our friends with our talent. I'm Walt Grayson.
Thanks for joining us tonight. Thanks again to Governor Tate Reeves, Dr. Paul Byers,
Petrifying
Jim
ourselves
Craig,
with
and
the, or we
Michel
can
for
discover
being part
living
of our
again
town hall.
and
For Walt
amaze.
Grayson, I'm Byron Brown. Until next week,
I'm Walt
make it a
Grayson.
good night. Thanks for joining us tonight. Thanks again.